Assalamu alaikum warahmatullah. My paper today is 1 year outcome of selective caries removal versus pulpotomy treatment of deep caries. It's a pilot randomized control trial done by Chua and his group from Singapore and published in the International Endodontic Journal 2023. As we know, in last decades, there is a controversy between selective caries removal and complete caries removal in terms of vital bulb therapy. Uh, uh, this is only this is the first study that they compare between selective caries removal and pulpotomy on mature permanent teeth. So the aim of this study, this is a two-armed parallel group randomized clinical trial, compared the risk of bulb necrosis and apical periodontitis in a teeth with deep caries extending at least 75% into a dentin that were treated with selective caries removal or pulpotomy. For sample size calculation, the required sample size was 76 teeth, so they aim to recruit a maximum of 120 teeth. For patient randomization and allocation, teeth were blindly randomized to receive either selective caries removal or pulpotomy treatment with up to 60 teeth in each group. For the treatment protocol, done by the treatment performed by 8 endodontic practitioners. They did selective caries removal and pulpotomy. And they follow up, and all teeth were reviewed at 6 months and 1 year post-treatment, and the outcome was classified as survival or root canal treatment needed based on the clinical and radiographic findings. For the results, 120 teeth from 101 patients, 6 teeth were excluded because they did not complete the allocated treatment, and 1 tooth was excluded as it was associated with a severe periodontal disease, leaving 58 teeth in the selective caries removal group and 55 teeth in the pulpotomy group that completed the treatment. Only one patient from selective caries removal group and 3 from pulpotomy group were censored by 6 months. At 1 year, 57 out of 58, which is 98% teeth from selective caries removal group and 87% teeth from pulpotomy group returned for the review. A statistically significant higher number of patients from pulpotomy group were lost to a follow-up, and pulpotomy required significantly more time when compared to selective caries removal. For the treatment outcome of selective caries removal and the pulpotomy, only 1 tooth in the pulpotomy group needed the further intervention for root canal treatment, but a total of 8 teeth in the selective caries removal group required a further intervention, and this was statistically significant. For the limitations of this study, the limitations of this study is that they have just only a short-term follow-up, which is 1 year, and it require longer or long-term follow-up more than 1 year. Also, it has a low sample size. Also, they include more than 1 tooth from the same patient. Here at the end, they they mentioned the prognostic factors for survival. Even though 8 of 9 teeth that required the further intervention presented with extremely deep caries depth was not a significant prognostic factor for survival at 12 months. And thank you so much.